but there's a lot of valuable things that will assist the patients dramatically, add to your profit margin, add to your profit and loss, as well as your cash flow.
Welcome to AMC. I'm Dr. Greg Miller. Do you want to know how you can budget for wealth? Today, John McGuire is going to teach you how to do so. You won't want to miss his tip on managing a positive cash flow. Let's get started.
Hi, I'm John McGuire, and today we're going to talk about budgeting for wealth. Now, with many of your practices, you're always looking to develop new patients as well as maintaining the patients that you have. And that is a good start and a key element to the overall success of the clinic. And how that relates to budgeting for wealth is quite simple. When you have new patients coming in as well as maintaining patients, you also have to worry about your entire overhead. And bringing new patients in, existing patients, is one of your single most important things for your collections and your total revenue. You do have to watch your number of staff, your overhead, your rent, and all those things included. However, keeping an eye on what's coming in and what's going out is going to be a key element for budgeting for wealth. Now let me explain that a little further. If you have a consistent record on your collections and you're forecasting where you're going to be in the future simply by growth and your track record and previous clinic performance, you're going to be able to adjust some of your overhead, streamline some of your processes, increase your collections over time. Again, all these things have a tremendous way of really developing wealth for you. So if you look back as an example, say last year you did $500,000 in collections, but your overhead was $400,000. And that may include paying yourself as the doctor, as an owner draw, or through salary, or both. But at the end of the day, what's left over and how much, what's your net profit, but how much cash you took in and how much cash went out are two very important things. So every month when you're looking at your financial statements, and if you don't have good financial statements, I suggest you get with an accountant and really review that and start getting some on a regular monthly basis. Because if you don't have great reporting and you don't understand your full financial picture of the business, as well as where you are with things, it's going to be very difficult to budget for wealth. If you have a very good profit and loss statement, a very good cash flow analysis and balance sheet, those are three extraordinary things that will help you plan out to really better earn for yourself and better plan for the future. So every month, if you've got X number of dollars coming in, and at the end of the month, your profit and loss statement shows a net profit. So after all your revenue comes in, all your overhead, and then your administrative, this is what your net profit was. Depending on what that dollar amount is, you'll also want to look at your cash flow statement, because your cash flow statement may reflect a positive cash balance or even a negative one. And even though you have a profitable profit and loss statement, you don't want a negative cash flow statement. So you're showing profitable, but you really don't have extra cash to invest in or save for the future. So those two things are very, very key when you're looking at managing your practice and where you can perform better and actually build out a plan for wealth and retirement or just moving into something else. So each month, as you get your corrected and balanced financial statements done, whether you have someone on staff that's qualified or an outside CPA source, you'll want to, one, look at how you can improve your revenue. Two, you'll want to really take a close eye on your spend. You know, that may be marketing, that may be rent, staff, it could be some ancillary services you're doing. What's that costing compared to revenue coming in? Perfect example, if you do massage and it's costing you each month $1,500, but you're only doing $2,000, is that worth the space in your clinic? And is it worth the time for employment when you could be generating higher revenues or higher services? You really want to look at each line item and be sure that you're taking full advantage of your profit and loss. You know, so you want to budget that out and you want to take a look at each line item and see where you can focus on to do and perform better in. And once you get to that habit, you can certainly build out better plans and working with your patients. So in other words, you know, a lot of chiropractors don't necessarily want to tell the patients exactly all the things they need, but what the cheapest way is to help them. You should really totally focus on what they need and don't worry about the dollars. And I know that's tough to hear, but in reality, if your mission is to help your community and help your patients, you shouldn't have to worry about that. It's something that you can work out with the patient, or the patient knows they need or will want because their health is that important to them. So one, first and foremost, find tools and services that are really going to impact your patients. Find things that are going to have a direct benefit for them and also help you grow and sustain a much more successful, higher profitable practice. Some of those items are nutrition. Some of those things could be ancillary services, can even be diagnostic tools and so forth. But there's a lot of valuable things that will assist the patients dramatically, add to your profit margin, add to your profit and loss, as well as your cash flow. An example, if you currently just have a average of $55 chiropractic visit, and you do some of those things and you reassess the value that you're providing, you could go from $55 to $95 a visit. Even if you sustain the same numbers of patient visits each month, you're still going to do considerably better on a collection standpoint and a profitability. So those are really, really fundamental things that are very important to really develop a better profit and loss statement, net profit, and cash flow. Because if you had the same number of patients every month, but increased your value per patient visit, you'll see a much better net profit and you'll see a much better cash flow. And then when you have that positive each month, because I'm a big fan at looking at the profit and loss statement and the cash flow statement. And if those positive, if both of those have positive numbers, you should have a plan in place where you allocate a certain portion of that to stay with the practice. So in other words, if you have a positive cash flow and a positive profit and loss, let's say, was $10,000 for the month of September, cash flow was a positive $12,000. Take the higher of the two, cut it in half, keep one half reserve into the practice, so keep it in the practice, and use the other portion to allocate with a financial planner or someone that you know that can help you build that wealth and budget. So again, let me rephrase that. If the month of September's profit and loss statement ended as a net profit of $12,000 and the cash flow was $10,000, take the higher of the two, in this case the $12,000, keep 50% reserved because you want to keep money in the business so that you can grow, and if certain things may happen or there's an emergency or issue that you have to deal with, you've got to maintain the level of cash within the practice. Practice isn't going to grow if you're not putting money back into it and keeping some in reserve for a number of different reasons. So once you split that in half, take that other half and use part of it for your owner draw, part of it for planning for the future, however you see fit, whatever a financial planner or an expert could help you with. Those are great ways to really utilize your practice to prepare yourself for later in life or a new career or whatever else that you would like to do in your future. So if you really stay disciplined to this approach, it's going to help your practice, it's going to help you personally, and it's certainly going to help your future as you start to develop out a plan. There's many things that many doctors do with this. This is a simple plan that we think is very effective, and at the same time, it's a healthy approach to your practice. It's a healthy attitude towards your patients, because first and foremost, if you don't have happy and patients who are satisfied with their outcomes, it's going to be very difficult. So first and foremost, focus on them, focus on what their needs are, and utilize that to give them what they need. Increase your collections, bring in new patients from referrals, as well as keeping and managing your overhead. All those simple things would seem difficult, really aren't. It's just a matter of spending the time, understanding them all, and putting yourself in a position to where you've got that positive net profit and positive cash flow to utilize those funds both for the practice and for yourself in future. My name's John McGuire, and I hope that was helpful.
If this has been helpful, like and subscribe to be notified whenever new videos come out. As always, we're here to help. Text us any questions you have to 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice. See you next week.